Thank you for all the work you've done in the area of digital PCR. And of course, congratulations on winning this Positive Droplet Award. Of course, this award is dedicated to people, individuals, and groups that have been promoting the expansion of the use of digital PCR in their specific field. So thank you for all the great work that you have done in this field.
Thank you.
Obviously, you've got a lot of, as we say, coals in the fire, lots of things that are going on in your lab. Tell us a little bit about some of this EGFR work that you've been doing.
In the past, in the initial evaluation, people discovered that the presence of EGFR mutations if EGFR mutations can be found in the lung cancer, then these people are more responsive to the EGFR tyrosine kinase inhibitors. But getting the tissue for the analysis of EGFR mutation is not always easy. In particular, in patients with more advanced cancers, taking a lung biopsy, a lung cancer biopsy may be difficult or may be dangerous. So at that time, we want to detect the EGFR mutations non-invasively through the analysis of plasma DNA. But that task is pretty challenging because the amount of EGFR mutations, so the amount of DNA derived from the cancer tissues is pretty low. And moreover, there are an overwhelming amount of DNA derived from non-cancer tissues. So the fractional concentrations of mutations would be very low. So until the emergence of the invention of the droplet digital PCR that can improve the workflow and the test becomes a viable routine clinical test. So I think the droplet digital PCR actually brings this digital PCR system for the mutation detections into a practical clinical laboratory.
Absolutely. Now, how about you mentioned organ transplant analysis? Have you started doing any of that, or have you done any of that?
We do a lot of methylation analysis. So we developed methylation markers for different organs. So one application is for the detection of liver metastasis, because for patients with cancers, one key issue affecting the treatment is whether they have metastasis. So, for example, in the colorectal cancer patients, if they have liver metastasis, then is extremely difficult to carry out surgical resection of the tumor for curative intent purpose. But if they don't have a metastasis, then it's basically treatable by surgical resection. So we think that we developed a method using digital PCR to detect the liver-specific DNA. So it is not the liver cancer DNA, it's liver DNA. When a colorectal cancer patients have liver metastasis, then we show that the liver DNA, the amount of liver DNA would increase when compared with those without liver metastasis.
You've got a lot of stuff going on. If you are able or willing to share, what is your next digital PCR target? What disease state are you looking at?
Yes, I think we are thinking about, because most of the research are focusing on extending the digital PCR applications to detect other mutations or other tissue-specific markers. But one thing that I personally believe would tremendously increase the utility of digital PCR is for the existing applications. The digital PCR is competing with real-time PCR because of its superior performance in sensitivity and specificity. I think one area that we are developing is to help to improve the utility of next generation sequencing. because next generation sequencing is still a more expensive technology
Yeah.
than digital PCR. So if we can, digital PCR can replace some of the utility of the next generation sequencing, then it is a much bigger market and is more valuable market. And also for next generation sequencing, there are still some workflow that needs to improve. For example, using short reads next generation sequencing, we cannot determine the haplotypes of people because it's short reads. So the two SNPs would always be on
Fragments.
different molecules. So it's basically there is no robust and low cost method for detecting haplotypes. So some methods so we can use bioinformatics way to deduce haplotypes. We can use long read sequencing like the PacBio or nanopore, but those are not very easy and is very high cost.
Yeah.
So one way that we are working on, but actually we have completed one work is we use digital PCR to link different regions together, because a single long molecule, if we can link two SNPs within the one droplet in a molecule together and use short reads to read it, then we can determine the haplotype of individuals very easily. And haplotyping is important in a number of ways, like the non-invasive prenatal testing to determine the haplotype is very important because it would allow us to crack monogenic diseases. And also in a wider applications like the pharmacogenomics analysis, which has become more and more important nowadays. That is an area that we are actively looking at.
Excellent. Excellent. Once again, I'd like to congratulate you on the Positive Droplet Award. And of course, thank you for all the hard work you've been doing in this field, successfully expanding the reach of digital PCR, and in doing so, helping tremendous number of people live better lives, which is one of our goals at Bio-Rad, is to help society as a whole. So thank you for your work and congratulations.